Is this through the stethoscope?
Anything getting castrated, I don't feel good about that.
Gosh, it's hard to hear over his snoring.
I think he's finally on the plane that I am used to, which is we should have about 30 minutes.
Hey, Dr. Colleen, Neil's gonna switch you out.
We're still at 80 beats per minute.
A clean hug towel too.
Behind you. Okay, Dr. Colleen's coming.
We've had some anesthesia struggles, so if you can just help us
Go fast.
go fast. And teach Carm at the same time?
Oh, yeah.
So, and we're doing pre-scrotal?
Yeah.
Do we have gloves?
Right behind you.
6.5.
Yep.
It took a long time to go down.
People can help us make sure that we go first. I'll be your assistant. And we've got suture.
Checked in for Castration number 3839.
It wasn't too odd.
You'll find it. And then where's that bump? If I need it. And then Carm, I'll take that bump up here just if I need it.
This is the one that has the ketamine and xylazine.
Okay, be really careful here. Here's a one on too. I don't know if you can see it. Okay, Jesus, I just have to keep my eye on my hands.
I did my first feed, but
After football, so pretty brittle. We make my incision, and we'll ligate it, and we'll probably get there in the canals, then we'll just close them out.
are you for up in my chips or over here?
Do we have any caramels or anything?
I do have some.
We have Doyens and
I heard that you
So I've got them right in this pre-scrotal.
I don't have the caramel.
There's no caramels. We have Doyens or that's
fine.
what we've got
Okay.
right there.
Beautiful. It's already filled out.
Now we'll take this. Oh, is it sterile? Can you put the glove wrapper on top?
Is in.
And I'll take something to blunt dissect. Perfect.
Still in a lot of debt though. stuff, but there's a lot of new ones now that
Heart's at 70.
We're gonna do some pulling.
I'll just like, I'm not comfortable twisting, so unless you're super comfortable twisting. Okay.
No, not okay.
So I'm just gonna do this like a dog.
That's what we had planned on, so let's just not deviate.
Okay, so I'm gonna clamp, and then I'm gonna move my clamp up.
I have monofilament and then I also have poly.
Yeah, let's do the one in your right hand.
Do I have that other glove wrapper or somewhere sterile to put under his butt? Anything pseudo sterile. Okay, I will take suture.
Suture?
A needle driver if we have one. Perfect. I'm going to do a Miller's and then a transfixing, and then I'm going to stick it back in there.
Okay.
So I'm going to go right in that crush where I took that farm.
Okay.
And I don't want to get any of this glove wrapper because it can start getting nasty. I thought I wanted it, and I'll change my mind. What I don't want to do is put foreign material in my suture. Or
Yeah.
anything.
Do you want, we could get another hot towel.
That would be great.
Another hot tub?
Okay.
I think we just need to have Emily be our backup
Just got a
tech for the moment.
I'm gonna reach for that cat xylazine right away.
nice cut Monaco.
Yeah, eat it. Put it in a burrito.
This is a donkey wrangler right here.
Really?
I'm going to do a transfixing above where I just put that in circling. I always put something below a transfixing because I've played myself
It took me a while to load
like that. So I just hit an artery with my transfixing, which is something that can absolutely happen. So that's why I have that Miller's below the transfixing.
Yeah.
Because I've had them bleed out of my transfixing when I can't get it back. So I always put something below.
It was about a good 25 minutes loaded up.
So I'm going to do
Strong guy, too.
a square knot on that side, and then I just pull this around, and then I'm going to put another square knot on this side.
My daughter's like, "Oh, do
I think a year is like up to 67. I guess 7,000.
So this is how they should be.
Where's
Yeah.
the thing? It just
Took us a while to get there.
So long.
Oh, yeah.
That was my bad. I forgot I already had that.
Yeah.
If you try to drag it in.
So watch it for a second, see if we have any bleeding. We don't. Can you open me a sterile gauze?
Whoa.
A sterile gauze?
It's in that box. Yeah.
Are we ready?
But I'll go ahead and send that back in. So I am going to suture these closed. We'll do that again, we'll do together. Yeah, he's got these big peaky rings.
I have your sterile gauze here.
Thanks. And so I'm going to push that testicle up into the same hole.
Okay.
And so since, you know, on the horses we did the
Scrotal bracing?
yeah, we did not do this here because we're going to close this.
Okay.
And so I just got to cut through this to get the other testicle out. I don't want to open it. That's a pain in the ass. You do not want to pull on these like a horse testicle, you'll rip this out.
Okay.
Okay, same thing here.
Mm-hmm.
I'm going to make a crush. And then I'm going to go below the crush.
Okay.
And that's where I'm going to put my suture. I'll do the Millers, then I'll do the transfixing.
Mm-hmm.
And then we're going to close those in little rings with just a little simple continuous pattern.
Okay.
Because they're open. They like to be open. Pigs.
Mm.
And I think, yeah, I don't know. I haven't used the Equi Twister in a pig, so I don't know how that affects the inguinal rings or if it kind of seals. I'm not sure. So we'll ask Neil about that.
Okay.
But that's my miller's knot. Right down in that crush. Cinch it down. I have way better purchase on that one than the last one. 2, 3, 4. And then we can go right above it. Same thing as last time. If you hit an artery, no big deal because we have a little security blanket underneath. Did you guys place a catheter or no?
We don't have anything small enough.
Oh,
We have 16 gauge catheters.
sad.
Yeah. Our anesthesia would have gone much better if we had.
Yeah, that's okay. Live and learn.
Next time I'm gonna bring some cordless clippers.
Yeah.
I'm gonna bring some
Big-
small animal.
No, you
catheters.
bring the DeWalt kit from the Nava. Oh fuck! I was talking to you guys and I forgot what I was doing. I'm just gonna put another transfixing because I just cut my suture when I should have done transfixing. But bring the DeWalt kit from Nava Nation.
Oh, the crash kit.
Yeah.
Yeah.
That's
a
what I
good
brought
idea.
to Subai, and I had no regrets
Smart.
because I hiked with it for 10 miles, and it was worth every huff
Every
and
step.
puff. Yeah.
will
So
do
I
that.
cut my suture when I should have tied it around, so now I'm just gonna put in a second transfixing on the other side.
Okay.
No problemo. And honestly, a pig this size, a miller's is probably fine.
Mm-hmm.
But it's your baby, so we're gonna make sure we do everything extra good here.
I can't believe how good he is now.
Yeah, I was like,
Just pick Colleen.
Yeah.
sure that name.
Yeah.
We were gonna call it.
Now we're Joseph.
Just all that. He was squeezing away.
Okay, so now we'll watch this, Carm.
Yeah.
No blood, no big deal, no problemo.
Yeah, that's
Stick it back in there. And so now I'm gonna take these. Do you have a surgical glove on? You should put a glove on. You gonna feel in there? You gonna feel in the things? Threw it in there and it's just like, oh, that's, we're going in.
I had a bunch of fire ones at work. Should have done
Oh, you did?
it. Yeah. They're just gonna trash it.
So once you palpate in there and palpate as far as you can go.
Okay.
And I'll need another 2-aught if we have one.
Yeah.
Sorry, I'm in your way. I just wanted to chip in the hole.
Oh, okay. Yeah, I see what you're saying.
Yeah,
Oh,
so I'm
yeah.
gonna put a little simple continuous in each side,
Okay.
and that'll help him not dump his guts on the ground.
Okay. And the same.
2-aught would be great, yeah.
Okay.
Does this happen with production pigs? No. Are they most of them fine? Yes. That's important to mention, but more and more people are having pet pigs, so you know they treat them like dogs and cats. So you gotta have a few techniques up your sleeve.
Mm-hmm.
Or do we have needle drivers or no? Or not needle drivers, forceps?
I think there's some. I have a small one here.
I'll take it. Do we don't have any thumb forceps? Probably not.
No.
Surgery tools. I don't want this actually.
So you're just bleeding? So you're just bleeding?
No, it's just from the opening in the skin.
He's out, huh?
I'm gonna sleep all day now.
Good nap.
I do have some dog carprofen in my truck if you want to send it.
Injectable?
No,
Oh,
just oral.
Go home. Got
Yeah.
it. Cool.
That's why I said just bring your carriers and unload the trunk area.
Yeah, we can do that too.
As long as he didn't get another NSAID. He didn't, right? He
As long as
hasn't.
it's
Okay.
harder to
We're
pull.
gonna be pulled up by carprofen. We'll just send it home with him, yeah. He can have one as soon as he's up and eating.
So now you just suturing it up?
Yeah. So where his inguinal ring
Alright,
is,
so the
just go
70.
straight into his M10.
And if I had thumb forceps, I'd put these sutures
So
deeper,
this will come up.
but I don't. So I'm just gonna make sure he doesn't
Well,
double
if we were
his guts on
gonna
the
try to
ground.
get our dental
Do you want to
elevator
take this back or
handy,
just throw them
if
away?
they wanna pull that too,
Eat it.
then, you know,
So, like,
better
cane
than
meal.
getting him down, we wanna pull it, we don't have an elevator.
He's biting all forward.
And hopefully something to pull it with after we've elevated it, right?
Did you have
I
to be in
do
the
have a
shade afterwards?
multi-tool in
Yeah,
my
just to cool down.
backpack
Just to make
that
sure it
I'd
stays
rather
cool and
have
not
actual
doesn't
dental
hot.
forceps.
Maybe
I'm sorry.
How's he
Kim can
doing?
take them back instead of just having them.
Normal pig,
Just wait till
pale
he gets
pink.
up first.
Oh, okay. You wow.
Yeah.
Oh, okay.
And I do an Aberdeen, which is a crowd favorite. And I can show you how to do this now if you don't already know. Do you already know the Aberdeen?
No.
It's just a hand tie, and it's real fast. And so in this one, I'm just going to go up one side and go back down the other. And so then I pull this through, and I can show you this later. Now it's done. Yeah, everyone likes to watch
That
this.
seemed pretty quick then.
Yeah, it's real quick. And so now it won't bunch up the other side when I pull on this side. I always like to put a knot on top of an Aberdeen because it's essentially a series of slip knots. But if you don't have a good knot, well, my partner works in rope access, so a lot of work at height with ropes, and he says if you can't tie a knot, tie a lot.
Something will catch.
Yeah.
I told her
How long ago did we? When's the last time this kid got any drugs?
1206.
That was the last time he got any drugs.
It's all catching up to it.
It's all catching up to it now.
Which is crazy because I were doing all the painful stuff.
I did not think that he was gonna.
Yeah, we were like abandoning.
I feel like this happens to me every time, and I'm like, and then like,
Nice. I like that.
it's all that.
Yeah, it's nice.
They're just so thick.
Then
So
I'll
we just
put
gotta be
his
more
sub-shoe
patient.
together.
Okay.
So we're gonna close him just because because why not?
Yeah. Utilize our drugs.
Yeah. And so pull the sub-Q together.
Do we have? Did we decide we don't have any antibiotics that we can do for him?
We have PPG. And
I mean, honestly, I think the surgery was pretty clean.
Yeah.
I don't have any concerns about it.
Okay.
Hey, you get over there, piggy hairs. Thanks for doing. So I just keep untucking these hairs from. We do not want to trap his little piggy hairs in there.
Incision site.
Yeah.
in the perfect world, we would clip.
Yeah.
Yeah. What'd you guys do? Trim?
Yeah, I took some bandages.
Some bandages.
Just a little haircut. I'm gonna cut him.
And he was still a little bit wiggly, so we tried to calmly trim as what we could.
And honestly, if I had glue, I wouldn't even do anything with the skin. I would just push it together and glue it, but I'll just put a few intradermal sutures in here and it'll look like he never had nothing going on down there. Plastic surgery.